Before the surgery, the pain had become very, very difficult and very hard. It would shut me down when I'd go to walking in my daily activities and so forth.
We're here today with Rosalinda Turner, who just recently underwent a lumbar fusion. You're about 2 weeks post-operative now?
That's right.
2 levels?
Yes.
Tell us about the pain you were having before this surgery.
Before the surgery, the pain had become very, very difficult and very hard. It would shut me down when I'd go to walking in my daily activities and so forth. My legs would just kind of start shutting down about hip level. So I'd have to stop and rest and then start again. So that was my main reason for coming to you, because I couldn't see not walking. I have to walk.
Understand.
So,
well,
it helped
yes,
tremendously.
What other kind of treatment did you try preoperatively before the surgery?
Let's see, we did therapy. We did, I had some water therapy. I had some exercise therapy. I had injections, the epidural, different types of epidural injections.
Now, how many of the epidurals did you have?
I had 3, and then I was supposed to start a series after the 3rd one to go in and burn that particular nerve that was causing all the problems. But I decided against that treatment and went with the surgery instead.
Okay. The day of the surgery, a lot of pain, a little bit of pain. What was it like the first time you stood up and the first time you walked around a little bit?
First time I stood up, there was quite a bit of pain, but it was kind of hard to describe. It wasn't really a hard constricting pain. It was like more of a real hard soreness pain, like somebody just beat you up.
Correct. Yeah, I usually tell people the first time they stand up it's going to be painful.
Yeah.
And then how long did that severe pain stay with you?
That severe pain stayed just for that first day and maybe just a little bit of second day, and then it just started easing up into a much lighter pain.
Okay. And then how do you feel today?
I feel so much better. It's a great difference in pain level, movement level.
So would you say the surgery was more painful than you thought it was going to be? Less painful?
Actually, it was less painful than I thought. It didn't have the same effect that I had on my previous surgery, which was regular surgery.
Okay.
But the pain level wasn't as high. The movement level was easier afterwards. So, and it wasn't really a pain per se, it was just a soreness.
Oh, okay. So you're a little less than 2 weeks ago, you had the surgery. And then what type of activities are you engaging in now? Pretty much normal activities?
Pretty much normal. My son and I clean our church twice a week, and we had a harvest party for the church, and we had a fellowship last night, and I tried to attend as much of them as I could at that particular time, so it's doing pretty good. It's doing pretty good.
Excellent, excellent. Then how did you get to the office here today?
I drove.
You drove yourself today? When did you start driving again?
About 3 or 4 days ago.
About 3 or 4 days ago. And anything else that you can think of that I haven't spoken about?
I'm glad I went ahead with the surgery. I really am. I'm pleased that I decided to go with the surgery instead of continuing with the epidurals, because I feel now that the main problem has been addressed, where otherwise we were going to bandage it.
The pain you were having before the surgery, has it gone, going away, or?
No, it's gone.
Gone, completely gone. Okay.
Yes, it's gone.
Excellent. Perfect.
Absolutely. It is perfect.
So what would you say to people thinking about having surgery on the back? You always hear about how horrible it is.
Everybody,
no one does well.
Everybody tells me, well, I wouldn't have surgery on my back. this one and that one I knew, and they crippled them and this and that. Well, I'd had the one back surgery that, like I said, was successful for about 18, 19 years. And then when I started having the problems again, and they said, well, you know, at your age, I wouldn't have surgery. I said, well, I don't see where my age has a whole lot to do with it if I'm going to stay mobile, you know. I wasn't afraid of the surgery as far as that went. To me, if you're having back problems and surgery can correct that problem, come see Dr. Smith. Come see Dr. Smith.
Very smart woman. Thank you very much.
Absolutely. You have a beautiful day.
You too. Thank you.